The exposed screw terminals and the voltage regulator and battery present a significant shock hazard, especially in the presence of moisture or when the battery is plugged in. The short distance between the uninsulated terminals and the vent holes could allow arcing and spark generation, posing a fire hazard. The modification of the laptop power supply by cutting off the secondary cord and hard wiring it to the 12 volts DC output of the regulator introduces safety risks. This may void the underwriter's laboratory's listing of the laptop and could lead to malfunction or damage. The battery should be underwriter's laboratories listed as a mobile power supply and as a component of the cart assembly. The Canadian Standards Association listing alone may not suffice for hospital use. The complete cart assembly should also be underwriter's laboratories listed as a medical electrical device. This would ensure that the cart meets safety standards for patient care environments. To mitigate these risks, firstly, insulate all exposed screw terminals and ensure that there is sufficient clearance between the terminals and any openings. Secondly, use the original laptop power supply or provide an alternative that meets underwriter's laboratory's safety requirements. Thirdly, the modified cart assembly should be evaluated by underwriters' laboratories and listed as a medical electrical device to ensure compliance with safety standards. Fourthly, any modifications made to the original equipment should be documented and approved by a qualified electrician or engineer. The current design of the cart presents several safety concerns that need to be addressed before it can be safely used in a healthcare environment. It is strongly recommended to obtain underwriters' laboratories listing for the cart assembly and to address the electrical hazards identified. Let's delve into each of these concerns and recommendations in more detail. Firstly, let's talk about the uninsulated screw terminals. These are a major safety issue. Imagine a nurse or a patient accidentally touching these terminals while the battery is charging. It could result in a serious electrical shock. The immediate solution is to properly insulate these terminals. This can be achieved by using terminal blocks with covers or applying electrical tape to completely cover the exposed metal. It's also important to ensure there's adequate clearance between these terminals and any openings in the cart's enclosure. This prevents accidental contact with conductive objects like paper clips or other small items. Secondly, the potential for arcing. Because the uninsulated terminals are close to the vent holes, there's a risk of arcing. Arcing occurs when electricity jumps across a gap, creating a spark. In a healthcare environment where flammable materials like alcohol-based sanitizers are commonly used, a spark could easily ignite a fire. To address this, consider relocating the terminals further away from the vent holes or adding a physical barrier to prevent objects from being inserted into the vent holes and contacting the terminals. The third concern is the improper laptop powering. The modification of the laptop power supply by cutting the cord and hard wiring it to the 12 volts DC output of the regulator is problematic for several reasons. The original laptop power supply is designed to provide a specific voltage, typically 19 volts DC, to the laptop. By bypassing this power supply and using a 12 volts DC regulator, you're potentially undervolting the laptop, which can lead to malfunction, damage to the battery, or even complete failure. Furthermore, modifying the power supply voids the underwriter's laboratory's listing of the laptop, making it non-compliant with safety standards. It's crucial to use the original laptop power supply or an underwriter's laboratory's listed alternative that provides the correct voltage. There are underwriters' laboratories listed DC to DC converters available that can safely step up the 12 volts DC to the required 19 volts DC for the laptop. Now, let's discuss the listing considerations, starting with the battery. The battery being used should be underwriters' laboratories listed as a mobile power supply. This ensures that the battery meets specific safety standards for its intended use. The Canadian Standards Association listing might not be sufficient for use in a hospital setting, as underwriters' laboratories is the widely recognized standard in the United States. An underwriter's laboratories listed battery will have undergone rigorous testing to ensure it's safe from overcharging, overheating, and other potential hazards. The cart assembly itself should also be underwriters' laboratories listed as a medical electrical device. This is particularly important because the cart is being used in a patient care environment. Underwriters Laboratories listing as a medical electrical device ensures that the cart meets stringent safety requirements for electrical safety, electromagnetic compatibility, and other factors relevant to medical equipment. The Underwriters Laboratories standard for medical electrical equipment, such as Underwriters Laboratories 60601.1, covers a wide range of safety aspects, including insulation, grounding, leakage current, and mechanical strength. By obtaining your Underwriters Laboratories listing for the entire cart assembly, you can demonstrate that it meets these requirements and is safe for use in a healthcare setting. Let's reiterate the recommendations for addressing these safety concerns. Firstly, insulate all exposed screw terminals and ensure sufficient clearance. This is a basic but crucial step in preventing electrical shocks. Use appropriate terminal blocks, covers, or electrical tape to completely insulate the terminals. Also, make sure that there's enough space between the terminals and any openings in the enclosure to prevent accidental contact. Secondly, correct laptop powering. Use the original laptop power supply or an Underwriters Laboratories listed alternative. This ensures that the laptop receives the correct voltage and that the power supply meets safety standards. If necessary, use an Underwriters Laboratories listed DC to DC converter to step up the voltage from 12 volts DC to 19 volts DC. Thirdly, obtain Underwriters Laboratories listing for the modified cart assembly. This is the most comprehensive way to ensure that the cart is safe for use in a healthcare environment. Contact Underwriters Laboratories or another qualified testing laboratory to have the cart evaluated and listed as a medical electrical device. Fourthly, document all modifications. Any changes made to the original equipment should be thoroughly documented and approved by a qualified electrician or engineer. This documentation should include detailed descriptions of the modifications, the reasons for making them, and any testing or analysis that was performed to ensure safety. It's also important to keep this documentation readily available for inspection. In conclusion, the current design of the wireless cart presents several safety concerns that must be addressed before it can be safely used in a healthcare environment. These concerns include exposed screw terminals, the potential for arcing, improper laptop powering, and the lack of Underwriters Laboratories listing for the battery and cart assembly. By following the recommendations outlined, you can mitigate these risks and ensure that the cart is safe for both patients and healthcare workers. Obtaining an Underwriters Laboratories listing for the cart assembly is strongly recommended as it provides the highest level of assurance that the cart meets all applicable safety standards. In addition to the specific recommendations discussed, there are some general safety practices that should be followed when working with electrical equipment. Always disconnect the power supply before working on any electrical components. Use appropriate personal protective equipment such as gloves and safety glasses. Never work on electrical equipment in wet or damp conditions. Be aware of the potential hazards of electricity and take precautions to avoid them. If you are not qualified to work on electrical equipment, seek the assistance of a qualified electrician or engineer. By following these safety practices, you can help prevent accidents and injuries. Let's talk about the National Electrical Code, or NEC, and how it relates to this situation. While the NEC primarily applies to fixed electrical installations, it provides valuable guidance on safe wiring practices and equipment installation. Several articles in the NEC are relevant to the design and modification of the wireless cart. For example, Article 400 covers flexible cords and cables which are used to connect the battery charger to the 120 volts AC receptacle. This article specifies the types of cords that are permitted for different applications and the requirements for strain relief and overcurrent protection. Article 517 addresses healthcare facilities. It provides specific requirements for electrical systems and patient care areas to minimize the risk of electrical shock. This article covers topics such as grounding, bonding, and leakage current. Article 600 covers electric signs and outline lighting. While the wireless cart is not strictly an electric sign, the principles of this article can be applied to ensure that the cart is properly grounded and protected from overcurrent. In addition to the NEC, there are other relevant standards and regulations that should be considered. The National Fire Protection Association, or NFPA, publishes several standards related to electrical safety, including NFPA 70E, which covers electrical safety in the workplace. The Occupational Safety and Health Administration, or OSHA, also has regulations related to electrical safety, which are enforced by federal and state agencies. It's important to be familiar with these standards and regulations and to ensure that the design and modification of the wireless cart comply with all applicable requirements. Now let's consider risk assessment. Before making any modifications to the wireless cart, it's essential to conduct a thorough risk assessment to identify potential hazards and evaluate the likelihood and severity of those hazards. This assessment should consider all aspects of the cart's design, including the electrical system, the mechanical components, and the intended use of the cart. The risk assessment should also involve input from a variety of stakeholders, including healthcare professionals, engineers, and safety experts. Based on the results of the risk assessment, you can develop a plan to mitigate the identified hazards. This plan should include specific actions to reduce the likelihood and severity of each hazard. For example, if the risk assessment identifies a potential for electrical shock, the mitigation plan might include insulating exposed terminals, providing grounding, and using ground fault circuit interrupters or GFCIs. The mitigation plan should be documented and reviewed regularly to ensure that it remains effective. In addition to addressing the specific safety concerns identified, it's also important to consider the overall design and functionality of the wireless cart. The cart should be designed to be user-friendly, easy to maintain, and resistant to damage. The materials used in the construction of the cart should be durable and non-toxic. The cart should also be designed to be easily cleaned and disinfected to prevent the spread of infection. The battery charging system should be designed to prevent overcharging and overheating. The cart should also be equipped with appropriate safety features, such as fuses and circuit breakers to protect against electrical overload. To provide additional context, let's compare this situation to similar situations involving medical equipment. In many hospitals, medical equipment is powered by uninterruptible power supplies, or UPSs, to ensure that it continues to operate during power outages. These UPS typically consist of a battery and an inverter that converts the DC voltage of the battery to AC voltage. The design and installation of these UPS are subject to strict safety requirements to prevent electrical hazards. Another example is the use of mobile medical carts in hospitals. These carts are often used to transport equipment and supplies from one location to another. The design of these carts must comply with safety standards to prevent tipping, rolling, and other hazards. It's important to learn from these examples and apply the same principles of safety and risk management to the design and modification of the wireless cart. To further address safety concerns, consider implementing a formal safety management system. A safety management system is a systematic approach to managing safety risks and ensuring that safety is a priority in all aspects of the organization. The key elements of a safety management system include a safety policy, a hazard identification and risk assessment process, a safety training program, and a system for monitoring and evaluating safety performance. The safety policy should clearly state the organization's commitment to safety and outline the responsibilities of all employees. The hazard identification and risk assessment process should be used to identify potential hazards and evaluate the risks associated with those hazards. The safety training program should provide employees with the knowledge and skills they need to work safely. The system for monitoring and evaluating safety performance should be used to track safety metrics and identify areas for improvement. By implementing a formal safety management system, you can create a culture of safety and ensure that safety is a priority in all aspects of the organization. Another important consideration is the maintenance and testing of the wireless cart. The cart should be regularly inspected and tested to ensure that it is in good working condition and that all safety features are functioning properly. The inspection should include a visual examination of the cart, the electrical system, and the mechanical components. The testing should include functional tests of the battery charging system, the power supply, and other critical components. The results of the inspections and tests should be documented, and any necessary repairs or adjustments should be made promptly. A preventive maintenance program should be established to ensure that the cart is properly maintained and that potential problems are identified and corrected before they cause a failure. The preventive maintenance program should include scheduled inspections, lubrication, and replacement of one part. In addition to the technical aspects of safety, it's also important to consider the human factors. Human factors refer to the characteristics of people that affect their ability to perform tasks safely and effectively. These characteristics include physical capabilities, cognitive abilities, and psychological factors. When designing and modifying the wireless cart, it's important to consider the human factors to ensure that the cart is user-friendly and that it minimizes the risk of human error. For example, the controls on the cart should be easy to reach and operate. The display should be clear and easy to read. The cart should be designed to minimize physical strain on the user. The cart should also be designed to minimize the potential for distractions and interruptions. By considering the human factors, you can improve the safety and effectiveness of the wireless cart. To conclude, ensuring the safety of the wireless cart in a healthcare environment requires a comprehensive approach that addresses electrical hazards, compliance with safety standards, risk assessment, design considerations, safety management systems, maintenance and testing, and human factors. By following the recommendations outlined, you can mitigate the risks associated with the cart and ensure that it is safe for both patients and healthcare workers. Remember, safety is not just a matter of compliance with regulations, it's a fundamental responsibility to protect the well-being of everyone involved.